Hi, this is Dr. Stephen with Outclick Magazine. Today I'm honored to bring to you Michael Bell, the president of Florida Medical Center. Michael, welcome to today's program.
Thank you very much. I appreciate the opportunity to be with you.
Thank you. We were chatting earlier and getting to know each other. We've worked with Florida Medical Center now for a while. I've gone out there. You all provide excellent care. People may or may not know this about me. My background is actually in medical education. I worked for 10 years at the University of Kentucky in the College of Medicine and for 4 years at the FIU College of Medicine and curriculum. And my doctorate, believe it or not, for people who don't know, is in patient-centered medicine and pediatrics. So I am always fascinated to hear about what's going on in our local healthcare industry. Michael, tell us about Florida Medical Center, maybe about your ambulatory and inpatient services that you all provide. We were chatting about earlier, but tell our viewers what are some of the opportunities that they have for the healthcare enterprise out there at Florida Medical Center.
Sure. Thank you for that opportunity. Florida Medical Center has been in serving the community for nearly 40 years. We were the first hospital that had open heart surgeries, cardiac care, and we continue that legacy. The Heart Institute of Florida is housed here. There's some really incredible things that are being done by our CV program. In particular, just last week, very excited to share with the community that here at Florida Medical Center, our surgeons were able to perform the first minimally invasive valve replacement surgery that was done without having to open up somebody's chest or break a rib, which is very commonly have to be done during a valve procedure. And we are the first in the country to do it right here at Florida Medical Center. We're going to have additional cases, and we're really going to become the training ground for surgeons to come to Fort Lauderdale to learn how to do this procedure. So Dr. Beyer, our senior CV surgeon, did a great job in bringing that to this community, and we'll be spreading it. So CV surgery, we also have interventional stroke. If you have signs of stroke, one-sided weakness, really need to get to a hospital like Florida Medical Center where we can do a thrombectomy, which is actually going into the brain and removing the blood clot that's causing the damage to the brain. The sooner you get to that treatment, the more brain and lifestyle and function is preserved for people. We have a great center of excellence around orthopedics. We do joint replacements. People come in one day, walk out the next day with new knees and hips. And as we get older, some of those things begin to be problematic. And somebody who had it done told me, they said they wish they would have done it sooner because of the relief and pain. Obviously, we also have our general surgery, bariatrics. We have a couple of surgeons that are doing amazing work. People are flying in from around the country and the world to have bariatric surgery, which allows them to lose weight fast, safely, and to be on the path to health, reducing blood pressure, reducing risk of diabetes. And so the stories and impact that we have on people's lives surgically around the community is very, very significant. I'm proud of what Florida Medical Center does. Of course, we have all the general medical and pulmonary, and we've been a critical partner to the community during the COVID pandemic, making sure that we're providing the best pulmonary care. And we've had some advanced treatments that were available here for folks, so they had an opportunity to recover during this devastating time in the last year and a half. So many, many different services. Most people don't realize the complexity and the types of services that we provide here at Florida Medical Center, and I appreciate the opportunity to share with your audience some of those services.
Mm-hmm. There is a lot going on out there. We came out there to the emergency room. We have a full emergency department, I believe, for people to come out if they need emergency services as well.
Yeah, we do. We have about 30 rooms and plenty of room, space for everybody to come in to receive emergency care. And the wait time is exceptionally low. I've seen it just in a few minutes. Of course, that varies a little bit by conditions of what's coming in, and folks are triaged. But I walk through several times a day through that ER, and the ER may have patients, but the lobby itself is empty. So that means we're getting patients back to a doctor very, very quickly. And that's very, very important for our community.
hmm My dissertation is on patient-centered medicine, and that's the modality of where physicians listen intently to the patients and design a treatment of care based on the physician's lifestyle and come up with a treatment plan based on their lifestyle. You all are a part of the Healthcare Equality Index from the Human Rights Council, which is Human Rights Campaign, excuse me, which is very impressive. If you would tell us about that, because that tells me you are listening and prepared for members of our community and our audience, Michael.
Yeah, that's great. Thank you for that opportunity as well. We're the only hospital that I'm aware of in Broward County that has been able to achieve designation in the Healthcare Equity Index. And it's a renewed process. Right now, we're going through with this transition with Stuart, making sure that our policies remain aligned with the goals. The goals there is to really make sure that we provide patient-centered care. The individual that comes to us, they come to us with a family. The family may not match what people think is a much more traditional view of what the family is: partners, domestic partners, spouses, children of different relationships that come in, and we allow and encourage all the members of that person's community to come and be a visitor, to come into the facility, be recognized as an important part of that family. Because what the LGBTQ community has reminded us and taught us over the years is that the definition of family is a very, very broad term. And it really, for many of us, becomes, it's who we choose to have in our family. And it may not always be the same as our traditional family of origin for a lot of different reasons. But in this particular case, it's really focusing on understanding and making sure that every person that encounters that patient is respectful, treats them like a human being, is aware of avoiding insensitive language that might cause further distress or harm to the emotional well-being of the patient. Really what it's about is, with all of our patients, treating them like they're a human being who has fears, concerns, is anxious, apprehensive, might be a little angry that they're in a hospital. It's not always an easy place to be. And the last thing they have to worry about is feeling that somebody is discriminating against them anyway. Patient-centered care to me is really about not just seeing the patient in the bed, but seeing the human being in the bed, surrounded with their family, their support system, their community, and really listening and hearing what their hopes, dreams, and aspirations are for their life, and for us to understand how we can help them.
Their hopes, dreams, and aspirations. I want people to hear that. I think that's so important. That's something that was so, it's not easily taught into the medical students when I was working with them. How do you teach that into students? How do you instill that into them? How do you make them feel comfortable? When I worked with medical students, not every student understood that when they came through the doors. It was very hard to instill. What we called the hallway conversations were much more important than what sometimes they learned in the classroom, and being able for the physicians to be able to communicate to patients in that way. What's maybe one thing you want to tell people about patient interactions that you would want them to know about Florida Medical Center?
Yeah, I think that, going back to what I touched on is that we really want to approach each patient again in understanding what their goal for health is. So if they can, it's not what I want for you, it's what is the lifestyle that you want to have, and the kind of life and well-being that you want to have, and how can we build a plan to make sure that you can achieve that. Very, very easy for us to impose our own values, our own idea of what health looks like for that individual, but each of us is different, and each of us has made different choices, consequences with that, but we can help manage some of the impact of some of those consequences. But it really begins with that bedside care. And you mentioned physicians. We have some excellent surgeons here. I was reminded the other day of Dr. Oken, who's one of our neurosurgeons, does a lot of spine surgeries here at Florida Medical Center. And all the staff say one of the things that so impresses us with her is how much time she takes with the patient, with the family, how she walks them through all the procedure ahead of time, and is constantly present with the family, because a hospital is a scary place. And oftentimes a surgeon will just come in and leave, and maybe you remember seeing them or not. and you certainly didn't understand everything they said. But she stays present. She stays on the floor. She stays kind of hovers. That's what they kind of describe. Dr. Oken hovers, and is really there just to make sure that the patient is getting the care that's needed clinically, but also is receiving the emotional support, the nursing support, and the administrative support that patient needs. That's really a dedication from a physician who's one of our leaders. And so if you talk about how do you get that communicated, how do you get that taught, it has to be demonstrated. And Dr. Oken is one of the physicians from Florida Medical Center that demonstrates those values of patient-centered care.
This brings back such great memories of working in medical education. I could talk about this topic all day, and I encourage people, be involved in your care, be involved in every step, learn about your medications, learn about your care, go in prepared, listen for what the physician is telling you, be involved. Don't just let them do it, be involved in it, and make sure you are proactive, because the physicians are there to help you and you are there to help them. It's an exciting process. Once you become involved in your care as a patient, you become healthier, and it becomes a fascinating journey, even more so when you become part of it. You all were also recently acquired by Steward Healthcare, along with 4 other hospitals, I believe, in South Florida. It was a huge move. Michael, if you would tell us about that acquisition and then what it's going to mean for Florida Medical Center and for the healthcare enterprises here in South Florida.
Yeah, thank you again. So Steward Healthcare purchased the 5 hospitals from Tenet, large national company. Steward is a very large but relatively young company that is moving quickly and growing quickly, not only in the United States, but internationally as well. 44 hospitals across the country now with the inclusion of the five hospitals. There's 5 hospitals also of Steward in the Melbourne Space Coast region as well. So they have a critical presence, or a critically sized presence in Florida and around the country. 5 hospitals also in Colombia. They're actually growing quite rapidly in Colombia, and 2 hospitals in Malta. It's kind of an interesting place, and I hope that I get a chance to go there someday. What Steward does is they come into communities and they believe in bringing world-class medical excellence into community hospitals. It's not about taking patients away from their community. So they go to some academic center, they go to some, large facility that's far away from their support system, far away from their family, far away from their community and their way of life. We believe in bringing that care to this community. So Florida Medical Center is a great example of that. That's why they saw the 5 hospitals in Miami as a great resource. Those 5 hospitals being Palmetto General Hospital, Hialeah Hospital in Hialeah, North Shore Medical Center, Coral Gables, and Florida Medical Center. Each one of those hospitals has highly specialized care that they're delivering directly into the community. And we're going to continue developing that. So that's a focus. The second area that they really are bringing to us is a physician-led focus. They're owned by physicians as an organization. The decisions are being led and made on the business side by physicians. And so they really are focusing first on the patient, on the clinical need, on the resources we need to deliver this world-class care. It's not based just on a business decision, but it also takes into consideration their clinical expertise. And one of the areas that begins to develop is we understand that healthcare is not just acute. And so one of the things you're going to begin seeing is Steward beginning to develop and establish through various ways, relationships, a network of care that people can get access to care from Steward closer to home, primary care centers, specialty offices throughout all of Broward. Eventually there'll be this network of providers that are connected to Florida Medical Center so that we have great continuum of care. So what happens in the office is shared with the providers that would take care of you in the hospital, and that prevents miscommunication, missed medications, missed information that would be important during an acute care phase. And what happens in the hospital is communicated back to that provider in the community so that there's all that follow-up information, education, and self-care can continue so the patient moves on the path to wellness. So what you're really seeing is Stuart's bringing in a physician perspective, understanding that it's not just about the hospital, but how do we build out a network of care so that people receive the right care at the right place in the right setting of care. But it's continuous, and the information is longitudinal, and information is shared appropriately so that you don't have to keep on telling that same story over again. But you know that experience when you go into a doctor's office and then you go down to another office and they ask you those same questions. As we build out this, there'll be one set of questions, and that information will follow you throughout the system. So you can just focus on taking care of yourself, feeling safe, and getting better.
That's interesting. We discussed in medical education a lot continuity of care,
Yes.
and that information flow, so that one person is cared for throughout multiple levels. That was a consistent struggle, because there were so many pieces and parts and so many people involved, and that continuity of care, the information, the electronic databases. I worked with, I think, 7 or 8 different hospitals in addition to private care centers. And the information was in so many places. It was a huge challenge. And so I applaud you. I applaud you for trying to migrate all that together, because it is a huge daunting task for patients who don't understand that there are all kinds of information systems that hospitals are trying to manage to get that patient data information in there, and to maintain that continuity of care. So I applaud you for those initiatives and that coming, because that will be a huge help for patient care. So thank you for working on that. That's exciting for me, from being on the inside of it and having to manage 9 different systems with students. Yes.
Yeah, that's the exciting part about Stuart being a young company. They don't have these big legacy investments in systems. I was just at a presentation where the IT showed how they reduced 51 applications to 8 core applications that help tie all these many different pieces together. And it's very exciting, because they're saying we have an opportunity to hop technologically where people are at in the fragmented system and move to really an integrated IT system that ties together all these pieces. And that's critical for us to deliver the type of care that patients need close to home, which is our goal.
Well, Michael, I've really enjoyed talking to you. I want to add a little piece. You and I were chatting earlier. We have a similar background. I went to Asbury College, which is now Asbury University. It's very hard to say that after all these years. And I went to Asbury Seminary. I wouldn't trade those years of my life for anything in the world. It was an amazing experience and shaped so much of who I am. You went to Trinity. So tell us a little about, just a few minutes, about your journey and how you grew up in the healthcare system, because I grew up in the medical education part, and you grew up more in the administrative part, Michael.
Yeah. So as we were sharing earlier, I went to Trinity Lutheran Seminary of the ELC in Columbus, Ohio, after I completed my enlistment in the Air Force. And obviously it was a personal calling, a sense of being obedient to serving the people. And really for me, it was also a great way for me to work on myself, work on my emotional and intelligence, my compassion, my empathy. And through that experience, not only with my classmates, but then also being put into a hospital setting as a chaplain, and then continuing to be a hospital chaplain after I graduated, being exposed to many, many different people of many, many different walks of life. And the one thing that you learn there, there was a concept they said is every patient you encounter is a book. You have a privilege to read it if you take time, and they'll tell you their story. It's not about telling them your story. You're telling them what you find to be meaningful, but listen for what they find to be meaningful and connecting in with that. Then using those moments in their life as sources of strength. So it teaches you really to work with a lot of different people, understand that everybody has a story. Everybody deserves to tell their story and continue living out that story. And I learned through that experience to create a safe space for those stories to be told and those lives to be lived. That's why it's absolutely critical for me as a hospital administrator. So as that shaped that, I wanted to become a leader that was living out those principles. And I had an opportunity to lead an organization and try to put those into the culture. And I'm very proud to be at Florida Medical Center because that's what we're on the path of doing. It's a journey every day. It's not never complete. And I think that if your community, if the people watching this, if the community of Broward County would give us an opportunity, they would find that they would find a safe place where they are going to receive excellent care, that they'll be supported, and that the outcomes for their life will be what they hope it's going to be. And so I see you've got our website up here.
Mm-hmm. For me, the two things of the entire year were the white coat ceremony, when students got the M1s got their white coat and they were crisp and clean. They didn't last, they weren't crisp and clean very long, but when they got their white coats, and the day of graduation when they walked across the stage and they became MD. They got their prescription pads and they wore their hood, and when they became MD. Those were the two moments of why I worked in medicine. And saw them become. I didn't work in GME. I only worked with UGME, but those 2 days were absolutely the reason why I did it. I hear that in your voice of you enjoy seeing patients have good experiences. And worked in administration, that's not always there, but I appreciate that you bring that to the table, Michael.
Yeah. So it's touching about that moment, right? And I understand what you're describing. I remember my first white coat as a chaplain. When they entrusted that to me, and what it was is it's the office, right? It's saying this isn't about you and your personality and whatever you bring to it. It's about the office. People are going to see you as a physician. They expect certain things. It's what Carl Jung called archetypes, and people are comforted by the archetype, by the physician that's going to come in. Be compassionate, be knowledgeable, be capable, professional, and competent. And that's what that white coat represents, something more than yourself. And so that's really what I believe drives me in healthcare. Is this is about something more than myself. It's about making a difference in the community. I can't think of any other organization in a community that has such an impact on people's lives. It's where we're born. It's where we're cared for when we need help. And in some cases, it's where we pass away. And so all the major life stages of our life are encountered in a hospital. And so let's really make sure it's a place where people receive compassionate moments that gives them strength to go through those challenging moments, and allow them to go and live beyond it. Absolutely essential, so much bigger than ourselves.
Thank you for sharing that. It's been a joy talking to you and working with Florida Medical Center. Chandler, if you can put up their website again so people can see that. Michael, tell us the address in case people when people want to come out there.
Yeah, sure. Thank you. It's 5000 West Oakland Boulevard. And we're out towards the Turnpike off of Oakland Boulevard. But you can also see us on November 20th and 21st. If you happen to be going down to Pride, Fort Lauderdale, come by the booth, say hi, get to know me a little bit better. I'd like to meet you.
Yep. You all are also sponsors of the Pride Center here and very proactive in our community. So, Michael, it's been such a joy talking to you and having you on the program. I look forward to working with you more, and maybe I'll look forward to being sick and coming out there. But
have you come out anytime? We'd love to see you.
We'll come out and see you. Thank you so much. Is there anything you wanted to share that I didn't ask as we wrap up, Michael?
No. I just, as I shared my story, I look forward to hearing and having people share their stories with me. And so again, you'll see me out in the community. You'll see me very visible. I think that's important that you have somebody that you can trust. In fact, I'm happy to give out my cell phone number. And if anybody has any questions, wants to reach out to me, it's 786-405-2367. If you have concerns about Florida Medical Center, or you have concerns about or questions about what we do here, I'm happy to take the call. I'm part of this community. I'm living here, and want to make sure I serve the community effectively by listening.
Well, thank you so much. Well, again, I'm Steven from Outclick Magazine, and we are, Chandler, get it up, outclick.com, OUTCLIQUE. Everyone stay safe and healthy, and if not, you now have a LGBTQ certified place to go, and that's Florida Medical Center. All right, everyone, we'll talk to you soon, and have a good evening. Thanks so much.